In this session, we will be getting into a deeper discussion about how young children are exposed to air pollution and the impact that has on their health and development, and then a discussion between the esteemed panel here. So the presentation will be given by Dr. Ajay, Head of Air Quality at World Resources Institute, India. And then we will hear from 4 different speakers on the panel. Dr. Vikas Desai is the Technical Director of the Urban Health and Climate Resilience Center of Excellence in Surat. Mr. Sandeep Narang is a Senior Advisor for the Council for Green and Eco-Friendly Movement at ASSOCHAM. Ms. Urban95 is an environmentalist and parent who's here representing Warrior Moms. And Dr. Anubha Rajesh is the chair for the Center for Early Childhood Development and Research at Jamia Milia, Islamia University. So with that, Ajay, I will hand over to you for your presentation. Ajay, we are not able to hear you. If you're
sorry, there was a problem with my internet. Yeah, so let me share my screen first. So thank you. Let me share screen. I hope you can see my screen. Yeah.
Yes.
Thank you. So thank you, Nandini. So I think Rusda has already touched on this topic, and she has given some data and stats about like how air pollution is impacting our children. So here I would like to just only brief about like what are the impacts of the air pollution, as well as like would like to give some data, Indian data, like what is the situation in India, and also what work required to solve this problem. So I would this is a very simple slide. I just wanted to know that that we most of the time we talks about the air pollution, but and we talk about the air PM 2.5, PM 2.5, but this is not the only the pollutant in the atmosphere. There are several other pollutants, primary pollutant and secondary pollutants. So while we are talking about the air pollution, so we also need to understand the different types of pollutant. I would not take much time for these slides. And so there are various sources of air pollution, and the most important pollutant which we are discussing these days is particulate matter. So I think that if you see that 10 years back, we were talking about the total suspended particulate matter. Then I think 5 years back, we started talking about the PM10 and now PM 2.5. Why we are talking about PM 2.5? Because we came to know that this is the most harmful pollutant which is affecting our health, our children's health. How PM 2.5 looks like? So this is a human hair, and this blue dot is the PM10, and within this blue dot, the 5th part of that blue dot is the PM 2.5. So this is a very harmful pollutant. And why this is very harmful? Because it contains several toxic substance, because that if it is coming from the exhaust emissions, there would be a different property. If it is coming from the plastic burning, so that's what we consider it's a very, very harmful substance for the our health and the air pollution in the atmosphere. So basically, because right now we are talking about the health, especially the children. And if we want to see that who are the people most affected by the air pollution, so we all know that children, older people, pregnant women, people who exercise outdoor, and people with the chronic lung and heart diseases. So I think that this is the number which is the global burden of disease number. We generally talks about the total premature mortalities. 100,000, 1 million, around 1 million people are dying because of the outdoor air pollution, and 0.6 million are dying because of the indoor pollution. I think we also need to understand the age-wise distribution. And if you see this figure, this is the total premature mortality in India because due to indoor and outdoor air pollution. You would find like about 10% are the children, 1 to 13 years, 0 to 13 years old. This is a huge number. It's more than 150,000 every year. I think India, this air pollution is responsible for premature death of 150,000 children. This is a very alarming number, and if we just want to segregate these numbers into the different age profile, we would find that the percentage, about 60% of these children are 0 to 6 days old, and then 7 to 16% are 7 to 27 days old. So most of the majority of the deaths are the early childhood deaths. This is a very important number. And that this is the, I think this sometime, because this is especially the researcher who works in the ground, they are facing this problem. People sometimes don't believe these numbers, the global burden of disease number. If we say that, oh, these are the number provided by the global burden of disease, they think, oh, these are the estimation. We do not believe on this number. So that's what whenever I present about the air pollution, I always brought this slide about these are the real data. This is the outpatient department data of the AIMS. So in 2016-17, this Indian Express has conducted a study. They collected the outpatient department data from 2 hospitals, and what they found that the number of patients has increased 300% from 2005 to 2014 and 15. This is a very alarming number, and it's a very huge increase. If we compare these percent increase with the GBD data, we would not find a similar trend. It means that somehow we were not able to capture the real ground impact of the health risk, air pollution. And I think the important thing this came up in this study is that most of these patients were children. So children are getting mostly affected, I think, by the air pollution, and that's what I think. That's what we are I think talking today, and that's what we need to work towards, like for the betterment of the air quality. So what are the general impact of the air pollution? So the children are having various health impacts. The air pollution stunts lung growth, reduce the lung function, impaired mental and motor development, low birth weight, childhood cancer, and increased risk of heart disease. And it's not like the children, when he born, he get affected by the air pollution. The exposure start from the, I think, when he comes into the I think this exposure start from the pregnancy. So I think when pregnant women are exposed to the pollution, they are more likely to give birth prematurely and have small low birth weight children. And these are the proven facts. That many of, because if you see the many of the studies in India, you find the people who are living near to the landfill, where the burning is happening continuously. You would find many of these are the population are having a low birth weight pregnancy. So so air pollution, the impact is, I think it's like that we are not aware about the most of the air pollution impacts, because the studies are ongoing. So if you find that it's not like about the lungs, it's affecting the lungs, but there are several causes are happening because of the air pollution. And if we want to see the data about this is the number from the Global Asthma Report 2018, and what they found that 6% of Indian children have asthma. This is a very big number. 6% of Indian children. If we estimate these numbers with the current children population, these are the millions of the children are having asthma in our country. Another study is conducted by researchers in India, Delhi, and they did an extensive survey in different parts of the Delhi, and what they found, they did a survey and they found that in industrial area, in Delhi industrial area, about 12% of the children were having the asthma, and residential area it's 7.5, rural area it's about 4, and totally about 8%. It means 8% of Delhi children are having the asthmatic problems. That's a critical number. Generally this is a common assumption, but we consider children as a small adults, but we need to remember that they are not small adults. They are different than us. Their airways are smaller and still developing. Their lungs are still growing. So the similar amount of pollutant would impact them differently. So they are especially affected by the air pollution. So this is very important. So especially for the children, if you know that if we really want to protect our children, I think we need to think of that, because millions of children are affected by the air pollution. And according to the data, if we see the data, 99% of our children are exposed to the toxic air pollution in India. I think they are very vulnerable to the air pollution. Why? Because they breathe more rapidly than adults, so absorb more pollutants. And the buggies and prams put them at the level of cars. But in India, we generally do not use these. But their height, like what this 95 centimeter heights came into the discussion, because their height is near to the ground. So they are more exposed to the air pollution. And this is the picture. You can see that this is a truck exhaust is coming out, and you can see these kids are directly exposed to the air pollution. And some of the data, like our team is working on the ground, and they are collecting this air pollutant data on the different heights. And you can see the air pollution level, because they are working, they are carrying their air quality instruments in the different neighborhoods of the various cities, and what they are finding, that the air pollution level, and these are proven by the other studies too, because the concentration level on the children height is the highest. So this is the situation if we compare with the adult height. And also we are also conducting a study about exposure time for the children, and what we are finding that about 3 to 4 hours in a house, especially the household where they are using biomass, the children spend that time with their caregiver, 3 to 4 hours, which 12%. And in general, 70 to 80% of they spend their time inside the household. And the air pollution level inside the household is about 500 microgram to 1000 microgram per cubic meter, especially for the household which are using biomass. So the situation is very alarming. So these are some pictures, and generally this is another thing. Like when we go to the ground, people think, when we are talking about this air pollution, they think, hum to kafi dinon se chulha use kar rahe hain, we are not getting affected. But that's not true. These are the the infant death per 100,000 births in India from 1950 to 2018, and you can see the decrease in number, and you can relate with the various infrastructure improvement, as well as the household cooking fuel infrastructure improvement. So it's affecting the children. After that, I think, what are the solutions? What solution we have to work on? So I think there are different solutions which we need to work on. First, we need to understand the air pollution sources, and we need to develop our strategies. For that, various studies are going on in the country. So similar thing which we are doing, the Surat city. What we are doing, we are analyzing air pollution activities at the neighborhood level. We are trying to develop a micro action plan for the city. Generally, people are developing an action plan for the entire city, but just to focusing on these like vulnerable population for the different socioeconomic background, we are trying to develop a micro level action plan for the city. And for city, and the Surat is one of the study area we are having right now. And for each type of air pollution sources, where it's restaurants or the biomass burning or the municipal solid waste burning, we are trying to assess the contribution, and we are trying to assess like what is the concentration level in the different neighborhoods, and what could be the solution that we can opt to mitigate the air pollution at the neighborhood level. If we really want to solve the problem, especially for our children, we all need to work at the neighborhood scale, and we have to develop the micro level action plan with the participation of the community and other stakeholders. That's what we have to do. Another solution is that whenever we are going out, we always, especially with the children, or whether our children is going out for the play, for a park or any other activity, we also need to understand the current air quality level, because sometimes we feel that if he or she is playing outside, he would feel happy, but that's not true, because if air quality level would be it's high, then there would be some long-term impact that we need to understand. We all aware about that we should not smoke inside the household. This is another thing which we need to always follow if we really want to protect our children from the air pollution. Because you know that we are developing these neighborhood level strategies. So this kind of strategy would also useful for this kind of practice. Like whenever we are going out, we should try to use the pedestrian and also try to avoid the routes where you have the high air pollution level. So always try to identify the air pollution hotspots in the cities. That's very important, and try to avoid while walking or driving in the city. And always I think we always, I think, keep our home well aired. That's very important. And stay in home. Another aspect is that these are the personal level mitigation strategies. And eat nutrient foods, drink plenty of water, and always use humidifier if there is a high air pollution level. With this, I would stop. Thank you so much.
Thank you, Ajay, for these striking statistics and really kind of powerful images. So I think now we will transition into the discussion with the panelists. So there are a number of questions, I think, in the chat as well. So we'll try and maybe take those towards the end after the discussion started. But I think it's over to you and the panelists now. So
we have, I think, diverse background of the panelists and the, I think, extensive experience they have in their field. So first, I think I would like to invite Dr. Vikas Desai. I think she has, I think, several years of experience in the area of, I think, community health and the social awareness. So Dr. Desai, we just wanted to understand what is your, I think, because since you have worked in the field, have you, I think, ever observed, like, what are your experience in terms of the air pollution, how it is affecting the air pollution and the different socio-economic background, as well as the, like, how we can involve community and the other stakeholders to solve this problem. And you know that, and sometimes it's very hard to convince the people in the ground because of this, because air pollution is the new topic, so they do not understand this. So how we can communicate and how we can convey this problem? This is the important topic that we need to discuss. Please, Dr. Desai, you need to unmute yourself.
Let me start with the last comment, that people don't understand and what to do with them. People do understand, but we need to convey the message to relate the cause and effect to them. People do know that there are certain health problems which are increasing, which they had never seen before, or the rate is increasing very fast. And even children know what to do for certain environmental and climate changes. And then they say, but our family does not insist on that, and that's why we don't practice it. So this is what is ground level learnings for us, which we have learned. So it's not that people don't know, but probably we as scientists have not rightly conveyed it to them. Another important thing is, we need to think of, this is a life cycle problem, starts from the conception and continues till the person survives. And there are the outcome, the health outcome are multi-causality outcomes. Say, for example, we say it affects lungs, it affects heart, it affects nutrition, it affects respiratory system, it affects the cerebrovascular system. There are several other factors also affected. And every challenge is increasing day by day. Now, in that situation, we need to create an evidence that this air pollution is linked to certain health problems, and this can be reduced. Unfortunately, the outcome is also irreversible. And that's why we are not treating them, we are managing them. even take example of even asthma. Now, what are the indicators we use? Increasing number of the cases in OPD is one indicator. Increasing death in the children is another indicator. And for research, what is used is increasing cases of childhood asthma. Now, where is the data? Unless the institution has the research interest, there is no data available. There is a national portal for health surveillance monitoring, which collects data from the country, entire country. There are state portals, but nowhere childhood asthma is included in the morbidity. So we don't get statistics from secondary data. You need to do research for that, or you need to plan prospective study to do that. And this is important because childhood asthma is something which is not much influenced by other factors. Once the person grows up, there are several other factors which also contribute to asthma. So that is one factor. Another important thing is, we have a number of projects, research, people understand, but it is not visible everywhere, air quality and health. And that's why the people don't link it. When there are several studies of Delhi, several news of Delhi which emerge in newspaper and in TV, and people do see it. And they say it is a Delhi problem. It's still not in my city. So unless it is perceived in early phase, Delhi is quite late case. And if it becomes a late case, then it's very difficult to prevent, control the health consequences of it. So if we want to do it early, we need to prepare a case for it. And how do we prepare a case for it? We need that to build up that attitude in entire system, which includes public sector, private sector, as well as in future urban practitioners and even youngsters who are not urban practitioners, but who are living in that city. And we need to plan that community participation in that, and even acceptance of the local self-government about the challenge and need to do something. So all these factors together probably will help us in building up a case, in building up an evidence. And what we need is, so some of the slides which I have seen up till now are talking about a society which is 50% of the city. Now, where is the inclusive action? Intra-domestic is poor, and outside neighborhood is other group? No. Every child is exposed to different types of exposures and the air insults. And we need to focus on holistically. And without passing on the message that it's for poor, it's for others. Working on heat action plan in Surat city, what we learned was people know that the temperature is increasing. People know that it is affecting their health, but they say what to do. So SOPs are not there with them. They don't know what to act, and they say whenever it will happen, we will see. Today we have to practically accept whatever situation is there. So that's what is the community attitude where we need to work on and focus on. And unless we do that, it will not happen. And I seriously believe that we need to work with all practitioners who can cross their boundaries. Not that they think only in their silos. That means urban planners and architects think about themselves only, and then help people think. They are hardly not much asked for in environment and climate, but they also think in different ways. They have their several other priorities. But the alarming thing is, number of respiratory viral infections are increasing. Air pollution is also increasing. Though there is no direct link, we all are at risk because of this duo. And both are respiratory insults. And that, though scientifically it is not proved that the viral infections have something, spread of virus through air has something to do with air pollution, both are going together. And that's where the upcoming challenges are higher and higher, and we will need to focus more on it. So joint trainings, capacity building, and working together is very important. Even for projects, all partners who can contribute and who can project the evidence need to work together in any city. That means if Surat is you are working for a micro planning of air pollution, where are the health evidences to link with it? Unless you link with it, people will not understand that in my city this is happening.
Yes.
I remember we used to teach fluorosis and iodine deficiency, and it was known only in some pockets of India. And everyone used to tell us that, oh, it is Punjab story, or it is sub-Himalayan belt story, unless it was proved that it is there in your own state also. So that's where the challenge lies, and people have several priorities. The community also have several priorities and constraints. Within that, we have to bring up the messages and prepare them to take care of themselves. And then we will be able to. But the corona has brought a lot of challenges and understanding of people. And it's the right time to talk about air pollution and health with them, and to bring that mood of protection and prevention. Because even with the weak lungs and the other consequences of air pollution, people will not be able to tolerate the insults of air pollution in time to come. Or even the new virus which will come and damage the lungs and create a problem. So it's the right time to act, right time to capture the things and work together. Thank you.
Thank you so much, Dr. Desai. I think this is a very important thing, because I think we had a earlier discussion also, like we need to come out from this mega cities air pollution thing, and many people are working in the silos. That's another important thing, and each and every stakeholder has their own priorities, and we need to work. I think we need to come up, or we need to I think come into the area where we can work on our interests and we can solve these problems also. This is very important thing, and thank you for your, I think, providing this experience. I think you learn a lot of things, and you are working on Surat from the long time, and so thank you so much for this. And moving forward, Dr. Anubha, Rajesh, because you know that since air pollution is the new topic and you are working with the early childhood development, so we just wanted to understand, like, you know, if you do have any like experience of any intervention which I think which has a very positive impact on the ground, whether it could be air pollution or any other sector, and which we can apply this same kind of intervention for the air pollution. Also, like what kind of strategies or intervention we should apply during the early childhood development, especially in the area where we do not have, I think, enough information, like Anganwadi, nursery, and other institutions.
Thank you so much, Ajay, and good evening to everybody. Yes, I feel that it's an extremely critical area. We are talking about young children, and everybody has emphasized how the young children get affected. They are extremely vulnerable to the air pollution. Apart from all the different points discussed, talking about that they are in the developing age, their organs get affected, they haven't developed their immunity. Children also spend a lot of time in outdoor spaces. And when outdoor spaces are not safe, because of their rapid breathing, they tend to take in a lot of pollutants. So I would say that there was another thing you talked about when you were talking to Dr. Desai, that how can we bring in this behavior change among our people? Most important would be to have informed communities. That's going to be very critical. It's not that it's any rocket science. We all know about these facts. It's just that we do not tend to be aggressive, and we do not tend to be responsible to carry them out. So what becomes important is that at a school level, at an Anganwadi level, at a preschool level, we need to have our teachers, our educators, our Anganwadi workers, we need to build in their capacities related to air pollution and other pollutions. Many times we can just build in these factors into the children's curriculum. They can talk about it, they can experience about it. We can, have situations where we discuss and debate about it. A simple example. During Diwali time, when in the schools, the teachers inform their children that we should not burn crackers. If we burn crackers, it's going to cause pollution and it's going to affect the health of all. We are going to have breathing issues and a lot more things. The children are very sensitive. They go home and tell their parents, no, mummy, papa, we are not going to buy crackers. We are going to say no. The teacher has said no to crackers. So I think so these small tips, when we start right at the level of a little child, they will be very effective agents. They'll be the advocates who can bring in the behavior change among their parents. And they can bring this only when they become aware. So that's why it's important to, go to the teachers and tell them and how to, very seamlessly, include these as a part of their curriculum development. I had a brief slide on the different solutions, which are very, very common. I mean, we all talk about it, but again, those are the, things that we need to talk about with the children, that how, by planting trees, how, about talking about managing waste, reducing your plastic carry bags, reusing whatever we have, choosing these cleaner commutes. We need to build in capacities of the teachers, and in turn they talk to their children, and that's where we'll start a small ripple, and this ripple will carry out to the larger community. And once we all are talking in the same way, we'll be able to create the change. And we need to understand that, yes, we have to come. We are not to wait for the fundings. We do not have to wait for anybody else, but we know how it's affecting our health, and let's be responsible of how to improve our health in the community. So I think so, yeah, that's what I would like to talk to about it. Thank you.
Thank you, Dr. Anubha. I think this is a very important aspect, that we all, I think if children are aware about these type of problem, as you mentioned, that they would definitely follow. I remember that when we was studying in the school, primary school and the secondary school, that time we had a special subject. It's called Sahayak Vachan, and in Hindi, because I'm from Hindi medium. And this there is another subject was called Nagrik Sat, civic science. So I think now that they are out of syllabus, but I think the similar kind of exercise we require from the early childhood, so the student can understand the problem on the ground. So these are the very important thing. And also, like as you mentioned, we do not need to wait for the funding or any other things. As a responsible citizen and responsible parents, we need to think of this air pollution thing, because it's harming everyone. It's not like a particular, it's for a particular population. So this is very important. So moving forward, I would like to invite Dr. Frost. I hope I'm pronouncing your name properly. Sher Banu, Mr. Sher Banu, because what we are talking, we are because I'm a scientist, we work in we develop emissions and we develop on the policy and science thing, and so we all have a different specialization, and we are working on that field. But the one important aspect is the parents, because they have to work because they would not wait for any funding or any research. They have to protect their children from, I think, it doesn't matter whether they have the mechanism available or not. So we just wanted to understand, what is your experience of working with the parents from the different background, not only the high socioeconomic background. I'm talking about all types of background, and what are their perception about the air pollution, and how they are, willing to participate in this kind of exercise to mitigate the air pollution, or at least understand air pollution, and they are awareing their children to just protect themselves from the air pollution. Please.
Thank you, Ajay. It was very interesting hearing everybody else talk about these things. I've been concerned about air pollution for about 5 years, and last year we started this group called Warrior Moms. when we first learned about air pollution, I think the reason it became such an urgent issue for us, for a few of us, is we started seeing the numbers. So you start seeing the numbers and you start seeing them in your house, and you start seeing the apps which tell you what the air pollution in your neighborhood. And then I got a handheld monitor, so I started to see what it was in my kitchen and what it is in the playground, and then you start sharing those numbers. And that's when a lot of people directly understand, because it's one thing to read a newspaper article saying that there's air pollution and it's bad for your children, and another thing to see on your WhatsApp neighborhood group somebody saying that, listen, your children are playing football, but the PM 2.5 is 500. I mean, do you really want your children to be playing football in this kind of atmosphere, right? Other things like bringing up things like cars idling in front of schools. Children are walking to school, and they're passing, dozens of cars, and again, their height, and the moment we spread that information, everybody brought it up with their schools, saying that, can we do something about why are our children walking past idling buses and idling cars to go into school every day? That's the maximum exposure. So just presenting numbers and sharing numbers in a community level, you only need one person in the community doing that, right? With a handheld monitor, so they can show those numbers. That's something we found was very powerful. But at the end of the day, you have to look at system change. I mean, a lot of us started off saying that, okay, we'll stop using plastic bags and we'll stop burning firecrackers and all these things. But, there's thermal power plants, and they're the biggest single point sources of air pollution, and they're not meeting the emissions norms, emission standards that were set in 2015. So now we've kind of moved to those kind of things where every time I've talked to scientists, they say that, we have all these solutions, we have all these policies that if we put them into place, we'll reduce pollution by so much. And the government also is saying the same thing, that we know these solutions and we know how to implement them, but what's missing is political will. What's missing is public pressure from the bottom saying we want clean air, because most people don't know that they want clean air, right? They don't associate the asthma with air pollution, the strokes, the lung cancer, the COPD. They don't associate those things with air pollution because their doctors never told them that they were. So even if 1% of everybody who was affected by air pollution kind of came out and put pressure and spoke up about it, there would be change. There would be an urgency in the government to recognize that, we had this huge response to COVID, but air pollution is killing twice as many people. So why isn't there, as much response? So I think we have to kind of also talk about putting pressure, policy change, strong lobbying, powerful group, and informing people that, and you should be upset. This is what is causing harm to your children, and not just the deaths, right? I mean, I'm concerned because I'm hearing about IQ loss. I'm hearing about stunting of height. And then you look around and you see parents of different socioeconomic backgrounds. They will not realize that their child, which grew up in a construction lot, breathing dust, breathing traffic pollution, their child is stunted because of air pollution, right? They will not realize that. But what chance does that child have later in life? I mean, you're talking about breaking the cycle of poverty, you're breaking so many obstacles. And if air pollution is one of those obstacles, and it's so invisible, and it's very hard to kind of to tell people that, this is the thing that is holding you back or your child back. So, we really have to get those health messages out, and very, very urgently, and then build this kind of public pressure and outcry for clean air. Thank you.
Thank you so much. I think this is a very important thing, like communication. I think somehow we are not able to communicate this message properly. This is, I think, with the air pollution, not only with the health, but in terms of the other interventions also. And we also need to understand, like many times I also talk during a presentation, like that air pollution is not a cause, it's a risk factor. It's like that when we somebody caught in accident and he had some injury or sometime he died, so we call it that he died because of the accident, but that's not true. Accident is a risk factor. Cause could be like a internal injury or like or blood overflow kind of thing. So similarly, the only difference between the accident and the air pollution is the timing. So that's what we are not realizing, that how air pollution is affecting our health. So this is the thing, that what we are talking about, like because we are considering air pollution as a one domain, and we are like a city or a neighborhood. But there are some sector like, that whether it's an industry or like a construction or like a restaurant, so they also face a special kind of risk. So for example, construction sector, I think many times we in our neighborhood we see like laborers are working with their kids. So we have Mr. Sandeep Narang with us, and we just wanted to understand what do you think about this air pollution and the construction? That these children are already vulnerable because they are not I think they are not able to have a proper education and some other facilities. So what do you think, like how these kids are affected by the air pollution, and what this sector can do to protect their health from this increasing air pollution? Yeah, please, Mr. Sandeep Narang.
Yeah, thank you, Ajay, and good evening, everyone. So it's highly enlightening session for me because I'm the first timer over here at Urban95, and talking about the construction sector, we usually have migrant labor working into the construction projects, and going by the data. So I have managed very big construction projects where there were more than 2,000 to 3,000 laborers working for me. And at a construction projects, we tend to have 10% as kids, say in the age of 0 to 15 years of the age. So if I am having a project size of 2,000 people where 2,000 workers are with me, I have 200 kids. And till today, our only focus were on 3 areas for the kids. One was their education, health, and nutrition. We used to talk about only these 3 aspects. And I never realized that how those kids at 95 centimeters will be breathing the construction air. So that's a very eye opener, and I believe lots of people are here from the municipalities and others. So we smart city missions. So what betterment we can do. Now going back to construction and air quality. So I and Ajay have been working closely for a few projects also. So I will talk about the positives. What are the positives happening in India right now? The biggest positive is that construction fraternity has admitted that construction sector is contributing dust. For last 5 to 7 years, we are in admission. Yes, that's the wrong with us. So with the policy making coming into the place, fogging machines were brought in. That's one of the good points. There are fogging machines now to settle the dust. And now even the contract documents, they mandate the contractors to mitigate construction dust during the construction. That's one of the very good things. And last few months, we have seen few policies coming where monitoring of air quality during construction has been made compulsory. These are very bright points. But what still to be done for the construction sector? And I will like to address to few of the municipal bodies I have seen in the participant list and smart city missions over here. There are, and Clean Air Asia also touched upon this. There are no research or studies on construction dust or construction processes. Almost zero studies. We in Delhi, we talk about bad air during the month of September, October, November, December, then you tend to forget it. Whereas construction is happening 12 months a year, and construction dust that escapes from the micro boundaries of construction is coming out of those boundaries and affecting the ambient air quality 12 months a year, 365 days a year we do construction. The second biggest factor is everyone talks about the road dust. What's the factor of construction dust to the road dust? How much road dust is the construction dust which has escaped the micro boundaries? There are no studies happening. And trust me, the smaller the construction size, you go to any small neighborhoods, there will be construction happening. And those constructions are highly unregulated, and they are contributing even more construction dust to the ambient air quality than what the bigger companies are doing. So we don't have any studies or data. That has to happen. What Dr. Ajay is also doing with that micro Surat plant. And one word which all the panelists and everyone is talking about is the capacity building. I'm a civil engineer. I'm part of this clean air action committees, funds. I don't see any civil engineer or architects coming and they being part of this capacity building. We need to train these engineers and architects who are constructing. They should be the informed community, as a word being used by one of my co-panelists. Capacity building is the key. All the smart city missions or pollution control bodies, local air bodies, they should be doing the capacity building for the construction professionals. And trust me, it's 0% capacity building happening throughout India. Even for the bigger projects I have seen happening in Delhi, they're the biggest projects of, I don't want to name them, they are everywhere. There is nothing happening over there. And coming back to the children, I don't want to speak what the construction dust or the dust has the effect, because we are the subject matter experts over here. Thank you, Ajay. That's what for me.
Thank you so much, Sandeep sir. Basically, yeah, this is a very important thing. Like we need to understand that there are several sectors which are unrecognized in our country, and especially in the most of the developing nation. Like a construction sector, we do not have enough information about their contribution to the air pollution. You know that if you see the most of the studies across the air pollution domain, you would find there are almost negligible information are available, or whatever the information are provided by the research study, those are based on the crude assumption. So not only the construction sector, whether you go to the restaurant sector or other sectors. So it's very important, like one thing is very important, that we all need to work for the better data, the better assessment, so then we can understand the problem in a better way. Because what is happening sometimes, like for example, like we need to divide sectors in the like easy to tough sector. There are some sector which require less amount of money and intervention and would have a better benefits. For example, municipal waste we are burning. I think about, if cities are already having 80% of municipal waste collection efficiency, and I think they are burning their 10% waste and contributing to the air pollution. Only improving this 20% efficiency would reduce 10% of the air pollution. So this is the kind of thing, like we need to divide sectors in a easy to tough to easy sectors like that. And another important thing which came into the discussion, especially Dr. The capacity building is not only for the stakeholders or the people who are working in the sector, but the capacity building of the community, capacity building of the teachers, capacity building of the parents, everyone's capacity building, their knowledge enhancement, that is very important. So here communication plays a strong role. I think we have a time constraints, so I would request Nandini if anybody has some questions. So I would so our panelists can answer their questions. Thank you so much.
Thank you, Ajay, and thank you, everyone. Yes, I have noticed a few questions. So one question that has come up here from Zahir Sheikh is, can improving ward level health center data and access to hospital records based on gender and age, would that help in strategizing better strategies for air pollution mitigation for younger children? If anybody would like to take this question.
I think Dr. Desai would be, can give you best answer for that.
Yeah, hospital statistics can be used, but not only of government hospitals, because when the child is very sick, it goes to private sector also for treatment. So even in poor families. And that's why we need to have a public-private reporting system to get a picture, not the actual number, but a distribution picture to convince and to work on it.
Thank you. Yes, so there's also another question here. that is about, sorry, I'm trying to pull out the question, from Sairam about, wanted to check if anybody's aware of a report that captures some of the best practices being discussed here that can be shared to help keep community informed and engaged. I'm sure that there are various resources. Perhaps we can kind of put these into the chat link. And I think there have been some shared here as well by others. So let me actually move to another question. So Dr. Riddhi Sethi asks, children thrive outdoors, they need to play outside for their growth and development. So kind of restricting them to indoors to save them from air pollution could lead to other kinds of development related issues. So if there are ideas or suggestions on the way out,
I wanted to, can I say something? So
sure,
this
please.
chart that was formed by Dr. Meera, I believe, in the US, and for India, where she kind of mentions that at different levels of air pollution, what are the kind of levels of activity that children can do outdoors? So if it's above 300 AQI, then you would not run outdoors. You would only walk, and then above 400, you won't even walk outdoors. So that chart is there. I think the My Right to Breathe movement had put that together. Also, studies have shown that depending on the AQI, there's a maximum number of activity that you should do, above which it'll hurt you more than help you, right? So in Delhi, it was something like half an hour. Of course, for children, I mean, they run 2 marathons a day. I think toddlers, the amount of running they do is 2 marathons a day. And so you can just imagine how hard it is to restrict activity and talk about things like, and indoors is not that much better than outdoors for them. So really, we really just have to solve outdoor air pollution. That's not too many other options there.
Just to add into it, yes, we have various ways, where we talk about, channelizing the traffic. We avoid the heavy traffics to move out in the evenings in spaces where children are playing. Ensure that the spaces that we have developed for children are safe and away from, these industrial areas. Trying to find out the best possible ways, and where, as you were saying, if we can measure which is the least hotspot, and we can just have those children playing out there. Also, we had, I'm forgetting the name, but on Sundays, we used to have a assigned area where everybody could come out and, you could do physical exercises, and there was no traffic, no movement. I think so that was so popular before the pandemic, and everybody used to look in the mornings for that Sunday Divas. So I think so those kind of, activities can be scheduled. And yes, children have to play outside. They need that. It's their right. And ensuring the best. We have all the 3 articles talking about it, whether we have Article 6, we have Article 24. They all talk about the right for a child to have safe and protective environments, a best and healthy survival right to live.
Thank you. So I think we probably have time for just one more question. And so kind of responding to this also, if some people have asked if anybody in the panel can share any examples that you might be aware of successful stories of interventions that have happened at neighborhood level, maybe in Indian cities or elsewhere. Ajay, maybe, I don't know if you have a sense.
Yeah. So I think intervention, yes. I think, that it's not only for the air pollution, but I would say that I was studying like a municipal solid waste burning in the different neighborhoods of the Delhi. And what I found, like we were studying the Janpura, Safdarjung enclave and the Brajpuri area. So these are the 3 different backgrounds, the socioeconomic background. And one thing which I think found very interesting in the Jangpura area, like I think the RWA and the neighborhood people, they were involved for just reducing the municipal solid waste burning and improving the waste collection efficiency. So I think that it's not easy to just work on for all the sectors, but you can work on some sector. Like waste burning is a very like a simple thing like which you can solve at the neighborhood level. So people are working in our country. Like this neighborhood, this Jankpura is the one example. There are RW is an example. The similar things are happening in the different neighborhoods. So we need to work on the sector basis. For example, if there is a burning happening, if there is a fuel is unnecessary pollution is coming out. So that kind of activities are happening and they are showing good results. Yes.
So actually, I wanted to just ask one more question, because there have been a couple of questions that I'm seeing, and I think a few people on the panel can address these related to policy, and one specifically here is about any guidelines of what has been adopted at construction sites or could be to reduce exposure of children there at the site and outside to pollution, and then and there's another about just understanding more about some of the regulations and enforcement that is already happening of industries where there is high rates of emissions and pollution.
So I think Sandeep sir, if you want to go, or I think so. The thing is that, like with Sandeep sir help, that to solve the construction problem, it's very, I think it's a tricky thing. So, but I think the first time in our country we were able to sit together, like a construction people, the government people, and we sat together and we develop a clean construction guideline for a country. This is the first time in India where the construction industry is willing to work to reduce the air pollution. And now I think this strategy, the air pollution intervention, we are going to implement on the ground, like how to solve the construction related air pollution. Sandeep sir, if you want to add, please add.
Yes, we need to create those model projects. Actually, there is nothing for the people to see how to do it, how to get it done. And there is no rocket science involved in tackling construction dust, or as I use the word, mitigation of construction dust within the micro boundaries of construction. We shouldn't be allowing the construction dust to escape the construction boundaries. We have those barricadings being prescribed by the policymakers, and there are barricades, but still, because there is zero capacity building on the people who are working over there. That's the key to it, and it doesn't cost anything. Just the key is to get those engineers, everyone understand. It's simple understanding construction dust as well as the soil. Once you increase the moisture content of the soil, PM 2.5, PM 10 won't get into the air or get out of the micro boundaries of the construction. There is no rocket science involved, but because there is nothing happening in capacity building and nobody knows, you go to any construction site, you will see clouds of dust everywhere. So fogging machines have come in as late as of now. And as I mentioned, it's the understanding of construction dust and how to mitigate by the people who are doing the construction. That's the key. Thank you.
Thank you, sir. Yes, thank you, Ajay and Dr. Rajesh, Dr. Desai, Sharvanu Frosh, and Sandeep sir as well for all of your comments. I'm glad we're actually a little, I think 10 minutes over our kind of schedule, but I'm glad we were able to kind of take some time for the discussion with the panelists too. Ajay, would you like to share any kind of closing remarks here before we move into the break?
So I think just the conclusion is, I think as I mentioned earlier, that I think the communication and the data, we need to have a proper data with informative data, open access data for everyone, so they can see the problem, because that we all are working on silos. And so if I have some data, somebody has other data, and we are not able to see each other data. So, and that's what sometimes I think whatever the policy is coming out, it could be, I think, misleading sometime. So I think the assessment of the air pollution sources and their data openly available should be the first thing, that it require a proper research. And another thing is the communication. We need to communicate whatever the information, whether it's a health intervention, properly to the people, so it can reach to the a bottom of the society to solve the problem. That's it. Thank you so much, everyone, for your time.